This is Dr. Rikedo of the Department of Anatomy and Cell Biology, School of Medical Sciences, University of Cape Coast. I present to you head and neck clinical correlation 2. So what is torticollis? This is the twisting of the neck. So tort actually stands for twisting, and then colli has got to do with the neck. So twisting of the neck, and this has got to do with the muscles of the neck, especially the sternocleidomastoid and then the trapezius muscles. So as indicated here, it affects the sternocleidomastoid and then the trapezius muscle. So in this diagram, you can see that the trapezius muscle is affected, and so the head is tilted. All right. So short, tight sternocleidomastoid is actually what is resulting in this kind of congenital anomaly. And because it happens before birth, it is termed as congenital. However, there are times it appears during delivery, okay, and that can also affect, especially during difficult deliveries, where inexperienced midwives pull the head of the neonate too much, with exerting a lot of pressure on the neck. It can also cause that. And then usually it affects the fibers of the muscle. It can get torn, and this can affect the neonate. So there are two main types of torticollis. These are the congenital and then the spasmodic. So the spasmodic one occurs during adulthood, right? While the congenital ones occur before birth. And then just after birth or during birth, the one that occurs due to difficult delivery is the muscular torticollis. So as you can see, the head is tilted away from the affected side and the chin is directed towards the affected side. A similar one like that. The subclavian is important during subclavian puncture. So the right or left subclavian vein is often the point of entry of medications, fluids, or venous nutrition to the venous system. So we are looking at this vein, which helps as a conduit to fluids or medications into the body of the patient. So that is the direction of entry using the needle or a catheter. And you also have the right cardiac catheterization. This is done to take measurement of the pressures in the right chambers of the heart. So what do? A puncture is made in the internal jugular vein, like this one, in order to introduce a catheter through the right brachiocephalic vein into the superior vena cava. So it means that you're actually moving inferior from here, you go down. So if you look at this, that is the vein access site, and then you insert the tube all the way to the right atrium. Then you have a slit in the skin, which the instrument exits, okay, and then hangs outside so that it can be monitored using the correct device. So again, this is a similar one. So vein entry, then exit site out of skin, catheter tail, and then the cap. So it enters the right atrium. The external jugular vein can be a very good sign clinically, because the It serves as an internal barometer during physical examinations of heart failure. So this is the external jugular vein. In the normal venous pressure, the external jugular vein will be seen just above the clavicle, okay, within a short distance to be seen. However, in high venous pressures, as in like heart failure, the external jugular vein will be very prominent throughout its course along the side of the neck to be so conspicuous. Okay, so that gives a sign of heart failure. Ligation of the external carotid artery may be necessary because its branches may be hard to reach. So you sometimes have to ligate the main artery. So ligation of this artery is sometimes necessary to control bleeding from one of its relatively inaccessible branches. This action decreases blood flow through the artery and its branches. However, it does not eliminate it entirely. So where you have very hard to reach branches that you can't actually access, then you need to ligate the bigger one to reduce blood flow to those difficult to access areas. Then you can also dissect the carotid triangle, which is within the anterior triangle. So this triangle provides access to the carotid arteries, the internal jugular vein, the vagus and hypoglossal nerves, as well as the cervical sympathetic trunk. So this is what we are talking about. You can see the vagus nerve is there in yellow. Okay. You also have the internal jugular vein. And you also have the carotid arteries. That is the common carotid, external carotid, and internal carotid arteries. Damage or compression of the vagus and recurrent laryngeal nerve during surgical operations within this triangle may cause an alteration in the voice, since these nerves supply the laryngeal muscles. All right, so like the vocalis muscle, etc. If these are affected, it's going to affect the speech. Hyperthyroidism is a common feature, clinical feature, due to excessive usage of the product of the thyroid gland, and so the gland is under pressure to keep producing, so it hypertrophies. So this can cause hyperthyroidism. The opposite is hypothyroidism, where the secretion of the thyroid gland is not used up by the body as much. So in the case of hyperthyroidism, you would need to remove the thyroid gland or any malignant tumor around it. So removal of the thyroid gland due to excision of a malignant tumor of the thyroid gland or other related structures. And sometimes there can be issues post-operatively. So post-operative hemorrhage after thyroid gland surgery may compress the trachea. Okay, the hemorrhage can compress the trachea, making breathing difficult. And because the neck is also compartmentalized in terms of the investing fascia that groups the structures within the neck into compartments and doesn't allow, spread of infections. This also can restrict, the hemorrhage can also be restricted to that particular compartment, and the more hemorrhage, the more the compression can occur. All right, so that is important to know. The superior and recurrent laryngeal nerves should be spared during thyroidectomy. Unilateral recurrent nerve injury will cause hoarseness of the voice. Okay, so unilateral means that it is not bilateral. So these are images of a few patients who have undergone thyroidectomy and a postoperative scar and wound healing that they have to be mindful of. So that is where the cut was made. And if you look at it critically, the cut is made along the crease of the skin, okay, where the skin creases along. Just like in this one, you see the creases from left to right. So you cut, along it. You don't cut across it. All right. So this region, the muscle beyond the skin will be, or deep to the skin will be the platysma. The Heimlich maneuver helps in aspirating foreign bodies out of the larynx. And it's also known as the abdominal thrust. So it was invented by Dr. Henry Heimlich, an American thoracic surgeon and medical researcher. And he did that to address the high incidence of death due to choking. So a person who is choking will usually cough in an attempt to dislodge the object. So this is how the Heimlich maneuver is done. And the one who has the choke is in front, and the one who is going to help will be behind. Then you clench your right fist, and then you put your left hand over it, and then you put pressure on the thorax, okay, the abdomen and the thorax, to cause the diaphragm to form a dome shape to push the air out, and this will help to dislodge the foreign body. So usually this is what happens. The arrow is indicating where the usual airway, okay, is through the larynx then into the trachea. And that is the epiglottis that usually covers the laryngeal inlet. But sometimes we talk and eat at the same time, so the epiglottis will be elevated, and then accidentally substances or objects can fall within the trachea. But usually it is lodged within the vestibule of the larynx. It hardly gets into the trachea unless it is very, very tiny, and then it can get lodged there. But usually it will be lodged here, all right, where you have the vestibule of the larynx. And because the epithelium of the ventricular fold is very, very sensitive, it causes this kind of what do you call violent coughing. Okay, so a foreign object can accidentally enter the laryngeal inlet into the vestibule of the larynx and get trapped superior to the vestibular fold. So these are the vestibular folds, so it will be trapped here. When an object passes through the laryngeal inlet and contacts the vestibular epithelium, violent coughing occurs. So there's a reflex action that causes a lot of coughs. Sudden compression of the abdomen causes the diaphragm to elevate and compress the lungs, expelling air from the trachea into the larynx. This helps dislodge food or objects from the larynx. This procedure is known as the Heimlich maneuver or abdominal thrust. So that is what is being demonstrated here. Okay, so you exert pressure in the abdomen towards the thorax, and then you cause air to rush out. Thank you very much. I hope this video helps.